So I was joining in a conversation on social media recently, and the question was asked about social skills and children with autism. And they said that they were a little bit confused because some of the parents in the group were describing their child with autism as as being really snuggly and cuddly, and yet they thought that one of the key diagnostic criteria for autism was a lack of social interaction. And so I actually chimed in, had my 2 cents worth, which I have a tendency to do, and I actually made the point to that the key diagnostic criteria is not an absence of social interaction or an absence of the ability to interact with people. It's a disordered social interaction. And so that disordered social interaction can present lots of different ways. So in some children, they will be very selectively affectionate, for example, or they'll be overly affectionate, or they'll be very withdrawn. And so there's lots of different ways that that disordered social interaction can present. But if you look at the way that your child interacts socially and it looks different to how other children interact socially, then it's worth having a look at whether or not you need to actually get a developmental assessment done for your child, because it's not about an absence of social interaction, although obviously that is a concern if that's describing your child, but it's if what they're doing is overly different to how other children normally interact, then it's probably worth getting some professional advice. So hopefully that's helped to clarify the difference between an absence of social interaction versus disordered social interaction, which is one of the key diagnostic criteria for autistic spectrum disorders. Talk, eat, play and learn, everybody. Until next time.